Local hospitals are feeling the crunch. Doctors say the rising number of COVID patients mean the level of care they can provide is being compromised in some cases. Investigative reporter Angie Racono is tracking the numbers in our region.
The best way to assess the COVID picture in our region is the Mid-America Regional Council. Here are some key facts. Cases are up 16% from last week. Hospitalizations are up more than 8%. And we have had 20 deaths in our region since Friday.
I think we're in trouble, and I think we're in trouble. I said once before, like last fall, that we were on fire, and I think we're on fire again. And I think the problem is that we don't have enough people vaccinated, and then folks are not following the rules of infection prevention and control.
The University of Kansas reports they have the most COVID patients they have had since January. They are no longer accepting transfer patients. Here's why. Staffing. They simply do not have the staff to treat all the COVID patients and all the other patients who have had heart attacks, strokes, and car crashes. Today in the morning briefing, they discussed the Kansas patient sent to Wisconsin and how they struggle to treat a pregnant mother with COVID. Other regional hospital leaders expressed the same concern. The hospital system is stretched and overwhelmed.
Yes, it was hard last winter, and staff saw untold numbers of deaths and people that were very sick and dealing with families. But when you have someone in the prime of their life, someone who's 40 years old, who's just clinging to life in an ICU unit, it's not only hard on the family who can't understand what the heck is going on, but it's also hard on the hospital staff having to deal with seeing young men and women and even children who are passing away as a result of this variant and what's happening there. That's a game changer.
Half of all patients at the University of Kansas are under 52 years old. The advice from doctors is clear. Mask up. This helps slow the spread. Vaccinations are safe and the best way to protect you from being hospitalized or placed on a ventilator. They point out Delta is much more contagious than the original strain of COVID-19. The old COVID-19, they consider you exposed in 15 minutes, but with Delta, it's just a few minutes. Angie Racono, KCTV5 News.